and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we have some folks from the health department who are going to talk to us about a new program that can protect people at high risk of getting HIV. My guests are Dr. Ella Webster and Karen Council. Welcome.
Thank you.
Thank you.
I had no idea that there was a preventative drug that could keep HIV from attaching basically to the cells in your body. This is huge.
It is. They've been working on this for a long time. There were a lot of false starts. This became available in 2012. It is a daily medication. It does have to be taken every day.
And so I guess what's new is that you guys are offering it.
Yes.
And HIV is not something we hear about in the popular culture the way we did, you know, in the late 80s or the early 90s during that time period. But Hampton Roads is one of the places with a higher than average rate, right?
Yes. The South in general has a higher infectivity rate. Virginia is generally lower, but Hampton Roads seems to be part of a band that goes DC, Baltimore, comes down the east coast of Virginia, and then goes down into the deeper South.
Not one of the things we're most proud of, but you know, you are what you are.
Yes, and we have a young population here too, which is going to increase things.
And let's be honest, it tends to, at least in the United States, or at least in this region, affect more men than women.
Yes.
Although we certainly have women who are at risk, who are partners of these men. So tell me more about this preventative and how people can get it.
Well, actually, the PrEP is a strategy to help people not get infected with HIV. Our population is men who sleep with men, which is gay. We have people who potentially has a large sex background. They have 10 or more partners. We have people that's in a relationship with a partner who has HIV. And we also have people who just don't know who their partners are. So that's our populations that we deal with through the PrEP program. But the medication is called Truvada. And the Truvada is made up of 2 HIV medications. One of them is called Virid, and the other one is called Imbetril. So those are the medications they receive. But like Dr. Webster says, they have to be consistent with the medication.
But you know, a lot of people are either afraid or don't know or can't afford medication. And you're removing a couple of those barriers.
Yes, because we have a grant through the Virginia Department of Health that pays for the labs, which pays for the doctor visits, and pays for a certain part of immunizations that they receive. When a client comes in, we tell them about the visits they're going to have. They're at least going to have 6 visits a year. The first one, they come in, they get tested for sexually transmitted diseases. They get to see the doctor. She go over their sex risk reductions. We talk about condoms. We talk about healthy relationships. And then they go and have their labs done. And once they finish that, they get to talk to our doctor.
All right, now I'm old school, and I remember AIDS when it first developed and HIV and all the scare and all the panic. And in my mind, we taught people to use condoms. We taught people to lower their risk. What has happened?
So AIDS has become a chronic disease. People live with it. They die with it, not of it.
It's less scary now, or it's less in the news, or?
And so teenagers don't think anything bad is going to happen to them. The increasing rate of infection in young men 13 to 19 is big. Yeah. They don't remember the funerals. You know, no. They were born since treatment started. Yeah.
Wow.
Yeah. And we've had 4, I can't say that, never mind.
But it is, you know, there's a number of people in this region. Do they come forward? I mean,
yes.
It's not the stigma that it once was, and people do know that HIV is treatable and manageable. It's not easy.
Yes.
It's not a great lifestyle. No. You don't want it, but it doesn't.
One of the side effects of the PrEP program is people who would be afraid to get tested will come in hoping that they can get on PrEP, and we're discovering that they have HIV. 8% of our screenings for PrEP come back positive.
How many do?
8%.
That's actually lower than I would have thought, because I do think a lot of people know they're at risk and just don't want to deal with it, are afraid to find out the answer. But here, if the answer is, I can prevent it,
Yes.
potential answer, people might come forward
Yes.
sooner.
We've been really pleased.
Yeah.
We're working with the local community-based organizations, MASS, Minority AIDS Support Services, LGBT Life Center, Hope in Home, and the International Black Women's Caucus, and we're providing the clinical piece of it, and they're providing the case management piece. People can also come to the STI clinic, Adult Care Services, and while they're being screened for sexually transmitted infections, the nurses will often mention PrEP if it seems appropriate.
Because sort of statistically, if you're at risk for HIV, you're at risk for other
Yes.
sexually
Yes.
transmitted
Yes.
infections as
Yes.
well. I mean,
Yes.
it's
and
Yes.
quarterly STI screening is a big part of the program as well. We check for syphilis, we check for HIV, we check for gonorrhea and chlamydia. There's been a huge bloom of syphilis nationwide, and that's fueling the HIV issue. And so we offer PrEP to anybody who comes in with new syphilis, and we offer PrEP to any gay men, because gay men are still a real risk population. The average gay man has a 1 in 11 lifetime risk of becoming HIV positive.
Now, is that a local statistic or national?
That's a national statistic,
Okay.
and it's a model. So
Okay.
it's the CDC took current numbers and trends in populations. And,
Right.
according to their model, gay men of color have a 1 in 2 lifetime risk of becoming HIV positive.
Wow.
That's what really got me off the fence about PrEP, because I, like you, remember the bad old days, and HIV medicines, any drug you take has a side effect. Why won't people use condoms? Condoms don't have side effects. But I cannot sit by and watch 1 in 2 gay men of color get infected with HIV. I won't do it.
Well, and you also mentioned women, and nationally, it is, internationally,
Yes.
more of a heterosexual disease.
Yes.
What are the risks for women, and particularly women of color?
So the risks for women of color are their partners. Women are more likely to get HIV from a man than a man is to get HIV from a woman,
Right.
just anatomically. And so if a woman's partner gets HIV and brings it home, she is much more likely to get infected than if she has HIV and they sleep together. Our number of our first patients
Yeah.
were partners of our HIV.
Most of our women is in a relationship with an HIV partner.
Now, is IV drug use still a big source of infections, or is that less statistically than?
Is in this area, but however, we still want to protect them by having PrEP. That we state that you can get on PrEP because you are
still at
yes.
risk.
Syringe exchange programs have been shown to rapidly and effectively decrease both the HIV rate and the hepatitis C rate in the drug-using population. And so
So some gains have been made there.
yes, and the commissioner actually has gotten permission to declare a health emergency and then to start needle exchange programs.
Okay, well, along those same lines, there are people who don't believe in needle exchange programs because they might promote problems. Does having something like this preventative drug just make it easier for people to have risky lifestyles?
No, because we promote condom use.
Every
And-
3 months.
Yes.
And the data on the programs that are already working show that people do not decrease their condom use when they start getting on PrEP, and it's sort of even. There's good data on lots of public health things that show that information does not promote risky behavior. Information decreases risky behavior.
So that fear is not realized in the actual facts of what happens in people's lifestyles. What else do we need to know? I mean, how do you reach people? I assume, Karen, you've got a lot of outreach programs.
Well, we are on the Virginia PrEP locator. We have put some posters out there. We have talked to other base organizations that does not have a clinician, that they come to us for the medical part of getting their labs done, getting their STIs done. So we are a resource center that we uses.
And the health department has always kind of been one of the first lines of sexually transmitted disease.
Yes.
People know they can go there.
Yes, absolutely.
And people who maybe don't want to tell their partner initially or their regular doctor initially,
Yes.
it is I think in a lot of people's minds is the first place. And so
Yes.
you're doing those screenings when people may or may not know
Yes.
what they have or if they have anything.
And although we're billing insurance in STI clinic when it's available now, that was sort of part of the changes of the ACA was to, CDC is cutting back on funding for STI screening because as the more of the
people.
population becomes insured. PrEP is completely free. The screening is free, the medications are free, the visits with me are free.
Now, why is that?
Because we wanted to get it
Funded,
started.
yeah.
Right.
We wanted to build the population. At this point, if somebody comes in and says they want PrEP, there's very few situations under which we'll say, no, it's not really appropriate for you. I did have somebody rule out because their kidney function wasn't good enough.
Or if they already have HIV,
Well, yes,
it's
yes,
too late.
yes.
But yes.
Yeah. And they may down the road ask people to charge their insurance if the PrEP population becomes large enough that we need to start focusing resources.
Well, yeah, you have X dollars, and
Yes.
if you could tap insurance, then you have X plus.
Yes.
Whatever that
Yes.
number is.
And
you
most
can treat
insurance
more
companies are
people.
paying for it because it's so much less expensive for them to take care of, to prevent it.
Well, and again, HIV is treatable, but it is a lifelong treatment that with a difficult regimen and pretty darn expensive drugs.
Yes.
So
It's a little like
sense.
becoming a type 1 diabetic, only more expensive.
Wow.
But see, now people are when they're getting diagnosed, they're not on a lot of medications like they were in the
Okay.
90s and
See,
the 80s.
You know, I'm old school on that.
Yeah, they're usually now, people are putting on one pill, but it's 3 medicine into one.
Okay, they've
It's-
combined
it's-
some of those.
Yes.
The majority of people are able to be controlled on a single pill regimen, and if they stay on their pills and don't stop them, they don't tend to develop resistance and they can stay on it long term. If they stop and start, that's where you start to see mounting resistance. And if they have people who already have HIV sometimes mistakenly think they don't need to use condoms, but you can get cross-infected with a resistant strain.
Oh, you
Yes.
mean if two people?
If two
Yeah,
people
right,
have
right,
HIV
right.
positive, yes.
But somebody who has HIV who is treated to an undetectable viral load has never been shown to transmit HIV. So treatment is part of prevention.
The goal is to get non-detective in their HIV regimen. And that's how most people are living. That's why you don't see people with
With those
symptoms.
the diseases
Yes.
that popped out
Yes.
the symptoms, yeah.
And HIV, the life expectancy with people with HIV these days is within 5 years of people without HIV.
Which is huge,
Huge.
amazing progress.
Yes.
But the goal that for the community and for the individual is still to prevent any diseases that we can prevent.
Yes. But diagnosis and treatment of HIV is part of prevention. People who know their status are much less likely to transmit HIV, and people who are in treatment are unlikely to transmit HIV.
Okay, so if people are watching this and maybe they have a suspicion that their partner may be putting them at risk, or they might have partners where they don't know a lot of information in the recent past, or they know they live a risky lifestyle, what do they do? Who are you looking for here?
That person, what you were just stating, we are looking for that person to come in and apply for the PrEP program.
And we're looking for young gay men who,
Especially, right?
particularly if they're not yet comfortable with the situation and they're a little bit in denial, PrEP doesn't have to be a lifetime commitment. We know people start to make better choices when they're 25.
Yeah, teenagers do a lot of risky things. Let's not pretend this is the only thing.
And because in gay couples, there's no risk of pregnancy, that there's a certain amount of disinhibition.
Yes. Ooh, you said that well. I would have not been as delicate.
So people parents, grandparents, cousins who think that they have a young gay member of the family, we really encourage them to bring them to the health department.
And this is hard because even now, people still don't always talk about it. And it's harder in some families or cultural neighborhoods or whatever than in others.
I still have a
And
kid who's terrified his parents are going to disown him.
that is sad because that's putting him at more risk.
Exactly. The closet is the most dangerous place to be.
Okay. So what do? They're
They cost
watching this. What are we gonna do?
727-1172. And they ask for Karen?
Extension 21739, and ask for Karen Council.
And we have an email address, which is hamptonhealthdepartment@vdh.virginia.gov.
And sometimes it's less scary to send, especially for young people. Young people don't deal always well with the phone. They'd rather text or email or click a link online.
And it is a the administrative assistant checks the email and distributes it, so don't put wildly personal information in it, but we will get back to people. Yeah.
Okay, and this is guaranteed funded for a year, and you're looking for it to
We're
be
expecting
a
it to be extended,
longer-term
yes.
program.
But I'm not making, I don't make promises I can't keep.
Now, we're less than 3 months into the fiscal year. Can I ask you how many people have come in or are part of this treatment now?
Well, actually, we have 44.
Wow.
Yeah.
Wow, that really, I mean, if
Norfolk
it's-
has
What about we have
120,
screening?
130. Yeah, we're the second biggest program.
it is an issue out there. Whether we want to admit it or deal with it or not, because some of us are more removed from the situation. You guys are on the front lines.
Yeah.
I am really surprised to find out it's that severe out there.
We also screen for the hepatitis, and we vaccinate them against A and B if they need to, if they're susceptible.
Okay. Well, thank you very much. This
You're
has been
welcome.
enlightening. And thank you for watching. I hope you've learned a lot, and think if you know someone out in the community that you suspect is at risk, that could be at risk, please put them in touch with the health department for their own sake, and as well for yours and for people that you know and love. Thanks for watching.